The reason that mammography is one of the most effective methods at detecting breast cancer is because it allows us the ability to detect very small cancers before a woman has any symptoms. Mammography can improve patient outcomes in multiple ways. One is to reduce the likelihood of death from breast cancer because we're able to find cancers at a much smaller size and earlier stage. The other reason is that it decreases the morbidity of treatment once someone is diagnosed with a breast cancer, meaning that if you find a cancer when it's very small, it may be curable with just surgery. You may not need additional treatments like chemotherapy, which can be difficult to tolerate sometimes for patients. So a mammogram is an incredibly low-dose X-ray of the breast tissue. Patients come in, it's a very non-invasive test. There is some positioning that the technologist will do to get the breast tissue onto our image, and then there is some compression of the breast tissue, which again helps us to see through that tissue. So what I recommend and what our practice recommends is in keeping with the American College of Radiology recommendations, and those are to start mammography at age 40 if you have no special risk factors, no family history, and to get those mammograms annually. So if they come for a screening mammogram, they don't have any symptoms, generally those patients will have an exam and they will leave the facility, and then the examination will be read by myself or one of my colleagues later that day or the following day. So the patient can expect a letter in the mail within a few days or a week if everything looks fine. And if there are any questions that we need to have the patient come back for additional imaging, they generally will get a phone call within a couple of days to come back for some additional views. Even if you're called back, if you're just playing the odds are overwhelmingly in your favor. It's so important because breast cancer is so very treatable and sometimes even curable when caught early. And so it will take 15 or 20 minutes of your time and it may end up saving your life.